top of the stomach, you have the gastroesophageal opening, and that section just inside will be the cardia of the stomach, and the fundus of the stomach is this area, or the rounded part, and then this region of the stomach is the pylorus. There's the pyloric sphincter here, the opening. This is the lesser curvature of the stomach, that would be a landmark. This is the greater curvature of the stomach, that would be a landmark. And then looking at the muscle layers, we have the longitudinal, the circular, and the oblique muscle layers. So this would be muscularis externa. Inside the stomach, we have the gastric folds, or the rugae. And then once the food leaves through the pyloric sphincter, we are at the first section of the small intestine, which is the duodenum. And then the next section will be the jejunum. The last section of the small intestine will be the ileum. Here's the pancreas with the pancreatic duct, and the common bile duct is going to enter here. Let's look at it on here. This is the common bile duct, inferior to the liver. This is the right lobe of the liver, the left lobe of the liver, the quadrate lobe, and the caudate lobe. This is the common hepatic duct, the falciform ligament between the right and left lobes, the round ligament, which is formed from the umbilical vein, the gallbladder, the cystic duct, so again they join to form the bile duct, the mesentery holds all the intestines together. This fatty portion of the mesentery hangs from the greater curvature of the stomach. It's the greater omentum. From the ileum, you have your ileocecal valve. Here's the cecum. Here's the appendix. Here's the ascending colon. Where it turns is the hepatic flexure or right colic flexure. Then you have your transverse colon, your splenic or left hepatic flexure, your descending colon, sigmoid colon, rectum, and anal canal and anus. Specifically, these structures are haustra, and this is your Taenia coli, and that's it.